So what is it that you see, and what is it you're telling people from, I guess, from an aesthetics perspective?
Well, I think what we're finding is that we are all leading very active lifestyles, and life doesn't stop at 65. It doesn't even stop at 72. But we continue to be active in either athletic endeavors or in family endeavors, and many times in professional endeavors. And those activities will take us well into our 70s or even 80s. And we're also, I think, finding that there's a tremendous amount of competition from a younger group. And as a result of that, many of us want to maintain a certain appearance about ourselves. We don't want to look like we're 20. We want to look natural, but we want to look like a very youthful age. We want to be able to manifest a sense of inner confidence and a sense of well-being, and the plastic surgery will help us to do that. We're finding statistically that over 10 million plastic surgery procedures are being performed a year. That is about 8 million non-surgical procedures and about 2 million surgical procedures. So as technology continues to improve, we are seeing a greater increase in the non-surgical interventions, the fillers and the Botox, which occupy probably about 50% of the non-surgical procedures.
Amazing.
It is amazing, actually.
Yeah.
When you consider that Botox was FDA approved in 2002, that's basically a track record of 8 years. It's now the most common non-surgical procedure that's performed in America today.
Do guys get Botox?
Absolutely.
Where would a guy like myself maybe get some Botox? On my face? Is that what Botox is primarily for?
Yes. Botox actually will temporarily interfere with muscles. And many times what we find is that muscle activity or muscle action is ingrained. So we develop these little frown lines here from the fact that we're constantly crunching small numbers or looking at a computer screen. Well, Botox will relax these muscles. Once these muscles are relaxed, the eyebrows open up a little bit, and it gives a much more open appearance to the eyes. Botox is wonderful. I love it.
So look at me now, and then look at me, I don't know, tomorrow. I'm not there yet. I have a question. So given that I work with an older clientele base, I would say 55 to 75-year-olds, is there a generation listening for your business?
Absolutely.
Tell me.
Absolutely.
Yeah.
Interestingly enough, about 25% of individuals undergoing cosmetic procedures are within that age range. And in that age range, we're looking at primarily a facial rejuvenation. We're looking at eyelid lifts and facial tucks. And we're also looking to a large degree at improvement in body contouring. The love handles or the gynecomastia or breast enlargement in men, and of course just general body contouring in women. And I think that's related to the fact that we are, again, leading a more active lifestyle, that we are working out and exercising, and we are looking to look our best and to feel our best, which plastic surgery helps us to do.
Helps, sure.
Absolutely.
Sure. And you're still passionate about this business.
Completely, and I think I'll be passionate for the next 20 or 30 years.
When does Beverly want to retire?
Never.
Never?
Never.
Got it. Got it. That's good. That's good. Yeah, you know, I'll watch TV or I'll be listening to people talk about how people are looked at, and they can spot someone automatically that they had some work done. Is that true?
No, absolutely not.
Tell more.
They can only spot the people who have had excessive amounts of work done. When cosmetic surgery is done properly, you cannot identify it. You cannot tell that Botox has been given or that fillers have been used. You can't tell a facelift, and you certainly can't tell a body contouring.
Right.
So when it's done by qualified, well-trained physicians, the results are very natural in appearance. Now, if someone came to me and said, I want to look plastic, could I do that? Sure. Absolutely.
Right.
Do people say that? Very, very rarely.
Right.
You know, I think the concept of extreme makeover is really a media concept, and it's not a reality concept.
Are you often fixing problems that maybe went bad?
Often, no. But do we have to correct problems? Sometimes we do. And I think it's part of the industry. Realistically, we're dealing with a human body. We're dealing with minutia and variations within the anatomy of each and every person that we deal with, so that we sometimes do have to tweak or correct issues that may be problematic or that a patient is just not completely satisfied with.